I'm Laurence Watkins. I'm a consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery. My specialty is hydrocephalus and disorders of the cerebrospinal fluid, so water that's in and around the brain and spine, and other things that are associated with that, so pressure problems inside the brain. I started off at Cambridge University. I did my basic degrees in medicine and neurosciences, cell science, all that kind of thing at Cambridge, and then did the medical school in Cambridge as well. But after that, my training was mainly in London, and much of it based at the National Hospital, where we are. But I also had some parts of it in other major teaching hospitals as well, and eventually got appointed as a consultant at the National Hospital in 1999. In keeping with my interest in cerebrospinal fluid, hydrocephalus, the things that I perform are shunts, which are basically micro-plumbing to take the excess fluid from one part of the body, the brain usually, to another part of the body, so it's like an overflow valve for the brain. So that's probably the most common, but also many other types of procedures to measure the pressure inside the brain, and also improving flow where there's an obstruction to the flow, and being able to analyze pressure problems inside the brain and how they relate to things like chronic headache, for example. Most of the research that I do is also in hydrocephalus and CSF disorders. So particularly we're interested in being able to measure the pressure inside the brain without opening the skin. So telemetrics, as it's called, being able to measure things from outside the body. And that's a big part of what has improved in technology over the last 10 or 20 years. And we're also interested in diagnostic markers in the blood or in the cerebrospinal fluid that can give us clues about other diseases. So those are my main research areas in this field. A lot of the conditions that I deal with are not going to be one and done, where you're never going to see that patient again. It's quite likely you will see them again in the future because they have a condition which can be managed but can't always be cured. So it's a long-term relationship with each individual patient, and they should trust that I and all the rest of the team are doing our best at all stages. The other thing is that patients often ask me, well, what would you do if your family member had this? And many doctors don't like answering that question, but I think it's a perfectly fair question. And so I try and imagine, okay, if this patient was a relative or a friend, what would I advise them? And that's usually the right answer for that patient as well.